Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson. Hi, Laura. Good morning.
Good morning.
So today we're going to be talking about naming reactivity and how that can be difficult for us as therapists, and also what we do that has helped us get more comfortable with naming reactivity in the room. And also, I'm sure you'll hear in there the importance and significance of naming reactivity. So what comes up for you as far as what is difficult about naming reactivity, either in your own experience or with your supervisees?
Well, I think that there's a lot of things that make it hard. When you're first learning EFT, it's hard to really even identify sometimes what's reactive, all the different ways that clients are reactive and all the different ways that they move into a less a protective stance rather than sharing their vulnerability.
Mm-hmm.
But especially as time goes on, I still struggle with those clients that, you just feel that extra need to take care of them. There's a fragility, there's a pain, there's a wound. It's really hard for them to see their own moves and to take on it. There's just a shield of shame that just says, I'm not going to go there. And I feel like I'm hurting them almost if I'm saying, look at what you do, right? Look at how you shift into anger when your heart hurts and you blast her. It's hard to say that sometimes when it feels like they're fragile and that you're going to wound them in some way. At least that's what happens for me.
Yes.
What about you? What's hard for you?
Well, I think just the feeling of it's so uncomfortable at first. I remember feeling so uncomfortable with pointing something out and potentially having someone feel blamed, especially if they're already sort of doing that with each other. How is what I'm going to say different than how what they hear from their partner? So are they going to feel blamed and get defensive? And I feel like that was a big one for me, just calling people out. And also seeing when people are stuck and seeing their partner's stuff, they don't want to talk about their own stuff. Maybe they really genuinely don't believe that they're doing anything that needs to be called out. And it's very much, this is what they're doing. And if they would stop doing this, then we would be fine. And so, can you just please help me with that? And so to help them see, well, let's see, is there anything happening over here with you that might be contributing to this too? It just, you kind of feel the defensiveness, and it can be, very hard to challenge like these very strongly held almost beliefs, or at least in those moments, right? They're just like, my eyeballs are facing out and they're the problem. So those are the ones that kind of stand out to me as being particularly hard to name the reactivity.
Right. I can just picture some of those clients where, it's like you have to sort of swim against the current to have them looking at themselves rather than what their camera, their lens, their whole orientation is so much towards what my partner is doing that makes me feel bad. It's hard to shift it in what they're doing. They don't want to hear that. They don't want to hear that.
Not always, no.
So and don't feel heard. Like you're not, so how, we have to sort of validate that and help them see what they're doing. As we're talking about how hard it is, it does make me think about how important it is also.
Right. Yeah.
So I'm thinking about some of those couples where I've gotten stuck, or I felt like, my gosh, I've been seeing them for 8 months and we're still in stage 1. And it's really, through some great supervision have to shout out to Dr. Sharon Chaput Lee, who is my mentor, one of my mentors, helping me name reactivity, especially in move one, of the tango, what's happening right now, that's required for de-escalation, especially with those difficult couples.
Right.
In EFT, sometimes we see their hearts, we see their longing, we see the beauty, and we want to sort of sprinkle that EFT fairy dust over their interactions and just say, oh, you love your partner and he means so much to you, and you're just so desperate to get through, and you reach however you can. Yes, and somebody needs to name it, right? And when you are trying to get through to him, your volume goes up and you use sharp, edgy words and you blast him with this really strong energy, anger.
Mm-hmm.
At some point, right, we got to name that stuff that is actually happening on the outside in a more reflective, objective, this is what's happening kind of way, because otherwise they're not going to see it.
Right.
And we don't move.
Yes. And as you were saying that, I was just thinking about their partner listening. When we reflect back, you blast them, you get edgy. It's such a relief, I think, to finally hear like, yes, this does happen and I'm not crazy, and it's hard. It hurts me. Like when they are hearing us reflect that back, they're also getting validated in their experience, which kind of is like, it helps them not get so defensive and not be saying, he or she is doing this, this, and this, and you need to know about it. Right. Because it's like we're putting it out there. We're saying, yes, we do see this. We do see that this is happening. And second important piece there, right? When we're in the target working zone in stage one, we're helping our client see what they do with their vulnerability, how they protect themselves, and the impact on their partner. Right. So when that partner hears it, they can, now you've got this lens expanded, right? Mm-hmm. We impact each other because we care, because of our connection. But when we do these protective moves, it kind of helps us feel safer, but it makes my partner feel less safe. Mm-hmm. We're holding up that mirror. And so I'm thinking about how we go about doing that in the session. And just like you said, oh, I see that you blast them here. And, one thing that helps make it easier for me to do that is I am coming from this perspective, and I'll even say that there must be a good reason. So help me understand if you clearly love this person very much. You want them to understand where you're coming from. And so you turn up the volume. So just a moment ago, when you just blasted him and you just, said this comment, help me understand what was happening inside just before you said that. And when they hear it in that context of, we get that you are, just fundamentally a good person trying to be a good partner, that this is coming from a good place that makes sense and that we want to understand even more. I think it helps sort of, take the edge off of us reflecting back their reactivity and naming it out loud, because we're coming from this place where we are seeing the good in them. We're holding the hope of the relationship. We're seeing the good in this person. And so we sort of are getting curious about, there must be a good reason that you're doing this. And I really want to understand, because clearly this person means a lot to you.
You need your protection right now, and that makes sense. And so that's a way we can help the client hear it, feel kind of seen and heard, even though we are holding up this mirror and naming the reactivity that they're doing. And I love that too, because that also brings in the attachment frame, right? And hopefully, right, it helps them have compassion for their own behavior.
Right.
Modeling that compassion. You do this for me. It's not because you're bad. It's because you're scared.
Right.
And it feels so bad when you can't get through.
Yes.
Or it feels so bad when you're feeling like you're getting it all wrong, with, just completely failing in his eyes. Of course, you need it, that protection in those moments. And when you do that, it has an impact on your partner too. Probably the opposite of what you wanted. Not so hard.
Right.
I was thinking, I think it's so important to add in that attachment, to add in the good reason. And then maybe another way that it makes it a little bit easier is to stay as close to the behavior that you're seeing in the room as possible. So if one partner is talking about, feeling confused about how his, cleaning the kitchen was not the good in his partner's eyes, when the partner rolls her eyes, you can say, wow, look at that. I just noticed something, right? He's talking about how confused he gets, that he's trying to get it right with you. And then he gets it, suddenly it's wrong. And you leaned back and you rolled your eyes. So I'm not adding anything in that's not just kind of descriptive, or that they're not saying, or I'm hearing or seeing. And then that gives me that, I know that that's happening for a good reason. Would it be okay to slow down here? And for me to check in what was happening for you, right? As he was saying that, when your kind of protection started coming up, you leaned back and you rolled your eyes. Because there you probably have a trigger live in the room, and you can, do that, try to understand what happened, what was the perception, blah, blah, blah.
Right. It's a beautiful example of the present moment process, like reflecting it right here in this moment. This is what happens. You're either in your cycle or starting to get into your cycle. And so let's just slow this down and use the content, what's alive, what's happening right here in the room. And that's one of the reasons I love working with couples, because it's so accessible. It's right there. And absolutely. I love that example. I don't know if you do this, but especially in the beginning when, we're building safety, I like to reflect it back, or have the enactment be on the outside, I do this, when on the inside, I'm feeling this. And they're not necessarily like in their vulnerability, but I think it's so helpful for them to be able to say it and for their partner to be able to hear it. So, once I start to ask them, what was the eye roll about? Help me understand. Oh, you started to hear excuses, or you started to like, what I was saying doesn't matter. They're always upset with me. And so you roll your eyes when you kind of feel like, oh, it doesn't matter anyhow. I'm not going to be heard here. Oh, okay. So can you turn to him and say, on the outside, I roll my eyes. On the inside, it feels like what I say doesn't matter. And that just, for them to sort of like, oh, sometimes they have a oh moment. Sometimes their partner has that like, oh, and then, that's just so helpful. I like being able to help them make that connection. And then I'll say like, wow, look what you just did here at home. The only option you really have is to roll your eyes and to move away, or to do, whatever the action tendency is. But look what you just did. From that same place, you feel that uneasiness of what I say doesn't matter. You turned and you told him about that. Wow, that's different. That's stepping out of the cycle. So
such a great example of a stage 1 tango. Move 1, what's happening right now? Right? When you hear him talk about this confusion when he cleaned the kitchen and you got mad, you roll your eyes, right? What's happening there? Trying to kind of figure out what's happening right now. Focus on the present process. I mean, the deepening, what was really going on the inside? How did that feel? What was that impact? In a stage 1, we aren't going like super, super, super deep on the experiencing, but we can get some of the meaning and some of the feeling that's there. And then that stage 1 de-escalation, naming the reactivity, enactment, that so as on the outside, when I do my reactive piece or my protective move, on the inside, this is what's happening for me. Right. Then you can process how that's different from when they get caught up in the cycle.
Right.
And it's just such a different way of them relating to each other. I mean, you're giving them that experiential learning, getting into the discomfort, talking in a different way, letting the partner see something that's not usually revealed. Yeah, super powerful. I love how you've kind of just fleshed out that whole tango moves.
So let's give the listeners maybe a way that let's close with how we have practiced naming the reactivity, because it is hard, right? That's why we're doing this. We want to recognize and validate for, everybody listening. It is hard to do this. And so can you share, Laura, what you have done that's helped you with naming reactivity?
Yeah. Well, and I can, we talk some and we're kind of putting ourselves on the line here. And I'm going to say, I tend to be more of a withdrawer. So it really makes me uncomfortable to call people out. I just, I'm so worried about getting it wrong, saying the wrong thing, getting somebody mad, hurting their feelings. So, what has helped me is to watch my session recordings and practice in a little bit safer environment. Literally watching it, pausing it, and figuring out, practicing how I would name what's happening to the client.
What a great idea.
It's challenging, right? Because we all are so busy and it takes a little bit of effort. But even if I'm, doing 10 minutes, most of what we see, especially in stage 1 in our sessions, is the cycle. And so there should be lots of opportunities. You can probably just start a tape, and within 5 minutes, you're going to be having good stuff to name and practice all the different ways of saying it.
Yes, that's a great point too. You don't have to watch your whole session. It can be like a 10-minute exercise. It doesn't have to take a long, long time. And I was thinking for myself, of course, supervision, watching my tapes with supervisors, role playing with supervisors is enormously helpful. And also just noticing like what's happening in my body before a couple even comes in. And I will notice the anxiety in my chest. I'll feel it in my stomach. And I think initially I felt kind of ashamed of that. Like I'm just supposed to always have it all together. And then with talking to a supervisor, I realized like that's me being in tune with the clients. That's me being, very present, and I can use my body and what I'm feeling on the inside as a tool. Like if I'm feeling this as the therapist, imagine what they must be feeling coming into the office or even before coming in, right? And just when their cycle is going, imagine what that must feel like for them. Maybe I'm experiencing just a little glimpse of that. And so that, one is just sort of like, it's okay for me to feel this nervousness, and it helps me empathize with how they might feel in the cycle. And then it is sort of this coming from a place of empathy, like I want to help them organize this, what feels sometimes probably like chaos and painful, cycle that they get caught in. I want to help them organize this. And I know that I can name it in a way that validates their experience. That's not at all shaming. That's not at all blaming. I can help them name like, oh, it makes sense that you do this. Of course you do this. Of course you do this when you get caught in the cycle, because he or she matters so much to you. It makes so much sense. So when I can sort of use my own body as a tool, it helps me sort of be motivated to, empathize and just dive in and organize the cycle so they can experience some relief from it.
Yes. That's beautiful. I really appreciate that. And I think that's really what we're modeling and also doing what we're asking our clients to do, which is to make space for the normal, uncomfortable feelings that come, right? When we kind of get into these intimate spaces where we have different needs and different styles and different backgrounds. And we're making space for our own discomfort through compassion with our clients and connection with our clients and compassion for ourselves. And it's in the service, right? We're not doing this just for fun. We're doing it because by going into that uncomfortable space and being there with them, we help them kind of see those things that are not helping them, right? That are backfiring in ways that create greater and greater disconnection. And so this is our way of reaching for them in our own discomfort in a way that helps them have some hope for greater closeness in their relationship.
Yes.
It's worth it.
Yes.
That's hard.
That is a great place to close out. It is worth it and it's hard. And that's why we're doing this show, right? Because we love this work and it's hard and we want you to know you're not alone. And so go out there, name the reactivity, and, you know, if it's bumpy, know you're not alone. It's bumpy for us still, even now, of course. So Thank you, Laura.
Thank you.
And we will see you all next time.
Sounds good. Thanks. See y'all.